Now at 4 o'clock, as the vaccine rollout continues, more questions are coming into the newsroom, and we want to answer those questions you've been asking. We are planning to do that every day this week. Joining us live right now is Dr. Jessica Abrantes-Figueiredo. She is the Chief of Infectious Diseases at St. Francis Hospital with Trinity Health. Doctor, thank you so much, as always, for being with us.
Thanks for having me.
All right, we talked to you last week a bunch of times on Facebook Live. You're the expert, and Alice Malero of Waterbury, she wants to know, do we need a booster every year, and what is the minimum age for this vaccine?
Great question. So with regards to booster, I think that's still up in the air, and we don't have those final answers. Ongoing trials based on the vaccines that have already been EUA or emergency use authorization are approved are still looking to see if potentially the need for boosters. And I think that will be a question that also needs to be answered as we figure out a lot of the variants that are going on, the spread. Even though cases are decreasing, we have to just make sure that we stay on top of this. With regards to the minimum age, so right now it's approved for adults, although Pfizer vaccine did get approval for 16 and above. Moderna got approved for 18 and above as far as age. Although both of those trials and other trials that are ongoing are actually recruiting and getting children in these trials to see if there's any safety issues that we would see differently between adults and children. And likely it's expected that we will have more vaccine available and approved as well in probably the spring to summertime for children.
Okay, good to know. Teresa Greenaway of Cromwell is asking, do they tell you which brand of vaccine you're getting, and can you ask for a certain brand?
So you do get told exactly which brand, and the big reason for that is people should know if they receive one vaccine versus the other, because your second dose should be the same as your first dose. Because of allocation issues and, mass vaccinating a lot of people at once, it's very hard to logistically, have people choose which vaccine. The good thing about Pfizer and Moderna is that they're very, very similar. So one versus the other really wouldn't have any big difference, but folks are definitely told which vaccine they'll receive.
And quickly here, Dr. Sharon Russo from Oakdale is asking this. If you're taking certain medications such as blood thinners, is it safe to get the COVID vaccination?
So yes, there's should be no issues specifically. I think what comes up with blood thinners is that you are getting an injection. So in typical scenarios, any type of injection, when someone is on blood thinners, you would worry about the potential for kind of bruising, et cetera. Something that you could definitely talk to your primary care physician or your provider about. But really, there's no indication to stop, especially chronic medications. And if people have specific questions about their specific medications, definitely best to reach out to that provider who prescribes it.
All right, a lot of good information there. Dr. Jessica Abrantes-Figueiredo, as always, thank you so much to you and all of your colleagues for everything you have been doing over the past year. It has certainly not gone unnoticed, so thank you.
Thank you.